What is post-mastectomy pain syndrome, or PMPS?
So post-mastectomy pain syndrome, it's in its name. So it's when it turns into chronic pain. So a lot of times if your pain is not well managed in the acute setting, right before surgery or 2 weeks after surgery, it can lead to chronic pain. And that can be different for everyone. It can be dullness, it could be soreness, it could be a burning sensation. It could also be similar to like phantom limb pain, where you feel like there's still a breast there and you feel like you're having breast pain, even though there's no breast tissue. And what that is sometimes the nerves that supply sensation and pain to that breast. Some of the nerves, in our brain and in our chest wall can be tricked to thinking that you still have a breast there and that you have breast pain. So the best way to prevent that from happening is to have a good post-op pain management. And one of the medications that works relatively well in preventing that is gabapentin, which is a nerve pain medication. So I typically give gabapentin to patients who are going to have a mastectomy. The ones who have a lumpectomy don't typically need that. But other things that can help with post-mastectomy pain syndrome is getting the physical medicine and rehab doctors, so PM&R, involved. So there's a lot that they can do, to help decrease the scarring, physical therapy, massages. If there's little pinpoints on the chest wall or trigger areas that are causing a lot of pain, and sometimes they can inject those with steroids, numbing cream, sometimes Botox if there's a lot of contractures in the chest wall. So if that's the case where you're having post-mastectomy pain syndrome, I would ask to see a doctor that specializes in cancer rehab.
Do those physicians typically work with a rehab team, it sounds like?
Or
physical therapists and whatnot to sort of bring it all together?
Well, sometimes, but a lot of times they're with the oncology or surgical oncology team at big cancer centers. And I think they're a group of physicians that's underutilized because their specialty relatively it is young, right? Like surgery has existed for a lot of years, internal medicine. Their specialty is one of the newer specialties that was developed in medicine. Mm-hmm. And then there's also not that many, relatively, there's not that many cancer rehab doctors. So I find that sometimes a lot of people may not know that they exist, but they're such a good resource, and then they really do a good job with managing any chronic side effects, whether it be pain or physical limitations or anything related to cancer treatment.
That's really